upsides to providing affordable, non-collateral loans to women in East Africa are numerous. Many of the women who receive loans from WMI learn valuable entrepreneurial skills and enjoy success in their business ventures, while also seeing improvements in other, more personal aspects of their lives. Women who partner with WMI often increase their monthly wages and net income. That newfound financial freedom then initiates a series of meaningful social impacts, allowing women to improve their homes, send their children to school, increase their meals per day, and even access proper medical services. Nearly half of WMI's participants state that they can more easily obtain food, medicine, or education for their children and family members, or that they have noticed an overall improvement in their family's living standards since entering the WMI loan program. Having the time and finances to address health and well-being is a critical result of WMI's loan program. According to the data collected during 2020 and 2021, 98% of women state that they have an easier time paying for medical fees since receiving their loans, and 100% of participants report that their diets have improved in some capacity.
I am Agutis Bena, the clinician at Karin Medical Center, Gulu, located in Agonga Parish. We receive a lot of women from WMI who bring in their children, other family members, and themselves. The loan through WMI is helping these women raise money through their businesses to pay for their medical bills.
WMI's commitment to accessible healthcare goes beyond just providing those initial loans that enrich women and eventually enable them to visit doctors. In fact, one of WMI's community engagement projects is a partnership with RAIN Uganda that conducts healthcare screenings for locals. The screenings test for cervical and breast cancer, HIV and AIDS, impaired vision, and abnormal blood pressure. By empowering women financially and supporting their entrance into the formal economy, WMI also helps entire families and communities prioritize their health. When women's businesses flourish, they are better able to pay their own medical bills as well as the bills of their loved ones. They might also feel more comfortable and better able to take time off of work to seek professional treatment. In addition to the collaboration with RAIN Uganda, WMI supports the Village Health Team, an organization that works to improve the health and sanitary conditions in Biobo and surrounding rural communities. The team conducts monthly home visits to promote hygiene techniques and to provide preventative health care to families. Today, the Village Health Team is comprised of 142 local volunteers that serve 71 different villages. With the ongoing effects of the COVID-19 pandemic hitting East Africa particularly hard at the moment, it remains vitally important for these women and their communities to access adequate and effective medical care. In addition to the more traditional screenings, the people in these villages also require COVID tests and vaccines, as well as the resources to properly sanitize and socially distance in the meantime. During the past year and a half, WMI refocused fundraising to provide personal protective equipment to its staff, infrared thermometers, masks, hand sanitizer, and foot pedal-operated hand-washing stations for hub and sub-hub locations. WMI also distributed emergency food and aid packages to local orphans as well as to communities in distress. Perhaps now, more than ever, it is important for organizations to continue to lend so that individuals in rural communities may overcome the coronavirus, remain engaged with healthcare systems, and assert control over their own well-being.